Good afternoon to one and all. I think I'm audible to everybody right now. Sorry for the delay. So we welcome all of you for the today's session of TMAS. This is the second session hosted by TMAS, which is an academic event. And this time we are having a specialty that we have got 1 point credit hour. Uh, we have got a point that one credit hour will be there for the session, and for the same we will be adding a link to the chat box soon. So please everybody join with your medical registration and your name. And the topic for discussion today is practical challenges in application and renewal of bloods and the licensing, which is a crucial aspect which needs to be known to the entire transition medicine fraternity. So, our speaker for today's session is Dr. Soumya Das. She is assistant professor and faculty in charge, Department of Transfusion Medicine, AIMS Nagpur. She has received many academic awards during her entire career. She is an expert resource person for WHO clinical use of blood manual, and she is a reviewer for many national international journals. She has got many national international papers and publications. So, I welcome you, madam, for current session. Madam, we can start sharing your slides.
Yeah, okay. Thank you. Thank you, Anila, for the such a nice introduction. At the outset, thank you, Transfusion Medicine Academic Society, for giving me this opportunity to deliver a talk on the practical challenges in application and renewal of a blood center license. So, it's a very interesting topic which as a MD student I have at least covered during my post graduation day and even subsequently till I got an opportunity of getting a chance of starting something, a blood center at this institute where I'm currently working. So we'll be covering this session under this broad subheadings. Like we will have a look at the what is CDSCO, what is the state drug licensing authority, what is the license application procedure, and then TMAS has a very interesting concept of asking the audience for the questions. So I have individually picked up all the questions and tried my level best to get you the answers for those questions. So we will be taking all the questions at the end. And along with that, if you have more questions during the session, do put it in the chat box so we can have more elaborate discussion on the same. Okay, so before I begin, disclaimer, whatever I learned for the licensing procedure is a journey of over 27 months of me joining AIMS Nagpur till I joined and then starting the blood center on 14th June this year on the occasion of World Blood Donors Day. So all my experiences will be more or less based around the experience what I have gained over that time. And before we go about with the details, please note that whenever we go for any licensing procedure for blood center, there is always an interstate variation. Some I have been to many of the south states, so many south states have a different concept. Maharashtra has a different concept where I'm currently based. So do check with your local drug inspector whenever we are into getting a license for the blood center, either grant or a renewal of the license. So to begin, human blood is considered as an elixir of life. And for that purpose, blood transfusion services is considered to be a vital part in the National Health Services. Hence, Drug and Cosmetic Act 1940, blood is considered as a drug under the section 2B. So as it is considered as a drug, that's why it requires comprehensive legislation to ensure that the quality control on the collection, testing, storage, distribution, and infusion of blood and blood components are of utmost quality is taken care. And this is led down by the Drug Controller General of India. Hence, the blood centers, the rules have been guided by the Drug and Cosmetic Act, which were again amended over the years, first in 1992 and 93, and then even we have a recent amendment which has come recently, and we'll be discussing a lot about that amendment as well. And please keep it in mind, the licensing authority are at two levels. One is a state level licensing authority, and the
Excuse
second
me,
is a
Soumya, can you just restart sharing? I think it just went out screen.
okay. Mm,
Request others also not to share in between.
is it coming now?
Yeah, it's okay. Now you can just make it full screen. Sorry.
Okay. Mm, yeah. So basically, just to briefly know about the organizational structure, because as a transfusion medicine specialist, blood centers are our bread and butter, and as per the latest amendment which has come out in 2020, the blood bank name has been replaced with the word blood center. So everywhere it is encouraged to use the word blood center. And once we see about the organizational structure, so we have at two levels. One is a CDSO. So CDSO has the Drug Controller General of India, who is a male, followed by the Joint Drug Controller, then the Deputy Drug Controllers and the Assistant Drug Controller, and then finally the Drug Inspectors. And many a times you will also have certain joint drug controller or deputy drug controller placed at different zones of the country, just to ease out the application procedure of a license. Like for Maharashtra, there is a west zone drug control CDSO office which exists. At Mumbai there is a south zone as well. So there is a east and there is a north zone. Coming to the state, at the state level, it is a state licensing authority which is mostly present at the capital, followed by deputy drug controller, which will be mostly at a district level, then the assistant drug controllers and the drug inspectors. Our majority state could be Hindi or English or any other local language which you have to use, but it has to be present in the at least bilingual or trilingual versions. You also have to have the forms of the blood request form, the blood component, the patient cross match, and the issue report. These forms also has to be there along with your entire application. This specimen is what I have been using at my center, that these are the forms and the certificates that is what I have at my center. Moving ahead, sometimes you might have to also submit a declaration that you won't be taking any donations from professional paid blood donors. So this document also needs to be attached along with the entire application set. So moving ahead, so once your application with all these documents is ready, it will be at least a 200 to 300 pages full application, because our SOP manual goes beyond 100 to 150 pages. So you have a very big application. Put it in a box file, and then in triplicate copy, submit the file to the state licensing authority. So you at a district level also they are available. State licensing authority is available mostly at the capital, but even at the district levels they are available. So they are very kind enough that they do accept our application, and they after their preliminary check, they forward the application to the state licensing authority and subsequently for the CDSCO New Delhi. Once the applications have gone, this is the official copy what you have submitted in triplicate. Along with that, you have to have 2 to 3 additional sets available with you, which will be using on the day of application, on the day of inspection. So what happens next? An inspector appointed under the act to enter, it could be, mostly it is with prior notice, or sometimes it could be a surprise visit to the any premises where the activities of the blood bank are being carried out for processing of human whole blood or blood and or blood product, to inspect the premises and the plant and the process of manufacture and the means employed for standardizing and testing the substance. The inspector is entitled to check all the registers and record maintained under these rules, and to take samples of the manufactured product, and shall supply to the inspector such information as he may require for the purpose of ascertaining whether the provision of act and rule thereunder have been observed or not. So the inspector will be visiting us. Subsequently, they will be issuing a, if they are satisfied with our all the work what we have done, then they will have their observations being taken about, and subsequently there will be a compliance which will be generated answering to the observations made by the inspectors, and then the inspector will again come to our site, where they will be seeing whether we have met the observations or not. And please note, for both grant and the renewal of the license, the inspection is mostly a joint inspection which happens both including the state licensing authority and the CDSU. If everything goes well, they will congratulations, they will ask for the new license, they will grant it. Suppose it's a renewal, they will look back how is the performance of the blood center in the past, and just always we need to keep it in mind that the entire part of this experience is to just to ensure that safe blood transfusion is being ensured, and there is always some opportunity to improve, and the licensing authorities do allow us to go about, and if they give some points, always take it in a positive sense that we are going to improve about in this aspect or some other aspect. So this is how it is. So after the inspection is over, the licensing authority seems satisfied. They will generate a report along with the application and the license in triplicate, and they will send it to the Central License Approval Authority, and they will issue us the license in Form 28C. If we have been satisfied, then we got the license in Form 28C. If they are not satisfied, then by order they have the right to refuse the grant or the renew of the license, and they will be giving us the explanation in writing why the license has been refused or has been withheld. And the validity of the license which is being issued by the licensing authority is for 5 years. Suppose you are rejected, no worries. If within a period of 6 months of rejection of application for the license applicant, inform the licensing authority that whatever points they have put across, you have met them, and deposit a fees of rupees 250. Then the licensing authority will again come and visit the site, and if they're satisfied with the work of improvement which has been done from your end, then they will grant you the license which has been compiled, and shall grant you the license or renew the license in the Form 28C. And again, just keep it in mind, we need to apply for the license, and it is always better to apply before your license is expired. And however, we all do everything in Form 27C, and it allows us that up till 6 months of expiry, prior to that, even after 6 months of expiry, you can apply for the renewal. However, you have to pay a fine of rupees 1,000 for each month's delay. Once you have applied and your renewal has not come, that doesn't mean that the blood center will stop working. That means that blood center can continue to operate the same till the order on their application has been communicated. Okay, so till here is how the entire application procedure goes about. So moving ahead, there have been many 18 18 participants who have asked for questions, so I have taken them, and anybody who has more questions can do ask their questions in the chat box, which will be taking further at the end of this session. So first question was the query regarding the application for NMC new course in transfusion medicine. I think Dr. Deep, this is beyond the scope of this lecture. I have completely focused on how we are going about with licensing procedure for or to be obtained for the blood center. Moving ahead, Dr. Pandip Kaur has asked how to proceed with the blood bank licensing, the documents required. I think it was pretty detailedly covered in the entire session. If you still have certain question, do ping it in the chat box. We'll take it at the end. Then comes, is there any special license to be taken for therapeutic plasma exchange? If it is under the purview of the blood center, yes, you have to show that you are doing it. For leukoreduced PRBC, yes, you do have to take the license. You have to add it as a one more extra product, and you have to show all the SOP, the validation studies that you are manufacturing the PRBC. Till you don't have the license to issue the leukoreduced PRBC, please note you cannot issue them for the patient use. Dr. Vikrant, I think in the entire session we had been discussing these steps, the basic steps in renewing the license. Okay. Dr. Priyadarshini had very interesting questions, and which made me go through nice, interesting literature. So her first question: within how many months of joining a workplace do I need to get my name endorsed in the blood bank license? If you are a transfusion medicine specialist with MD transfusion medicine, MD IHBT, or DNB transfusion medicine, it is better to do it right away, because as such you have dedicated your entire career to transfusion medicine, so you don't need any extra experience. And what are the consequences? The blood bank is always legally held, so yeah, there as such the law doesn't have any legal consequences being written, but it is always better to keep ourselves safe in getting the name added to the licensing, because many of the blood bank staff will the BTOs will have to sign on all the documents. Moving ahead, what are the legal consequences that I face without getting my name endorsed in BB license beyond the required period? I'm sorry, I didn't get any. I got certain issues with the legal proceedings, which will go about. But exactly what will happen if your name is not added, I didn't get. But it is always safe to get your name added, because you will be signing on all the label, all the cross match reports, all the blood grouping reports, and it's always better to get your name added. Procedure to get the name endorsed to the BB license. I gave an overview of the procedure, what happens. You can get in touch with your local licensing authority by which what is specific to Chennai, they can guide you. And time period given to correct the changes by the suggested by drug controller, again it's up to you. We ask them for a deadline that within 10 days, 1 month, 2 months. It all depends on how major are the corrections. If there are very minor corrections, then you can do it within and it is mostly the blood center which ask for that permission, that Within this period, we will be submitting the observation, the compliance report. So it's your call completely, and it is always sooner the better. The fine and penalty under each section of the BB license. So these are the few things I got. Coming to blood bank which runs without a valid license can be held imprisonment not less than 1 year, but may extend more than 3 years. A fine of not less than 5,000 can be charged to the blood center. Manufacture or sale of contaminated blood with HIV, HBV, or non-sterile blood products, then it is imprisonment not less than 5 years, but may extend to a term of life, and fine not less than 10,000. Manufacture or sale of blood which is not labeled, then one is accountable for imprisonment not less than 1 year, but may extend to 2 years with a fine of 1,000. Manufacture or sale of blood in accordance with conditions of the not in accordance with conditions of the license, imprisonment not less than 1 year but may extend to 2 years can be given. Other than that, there are few more punishments, penalties which are being offered if there is any offenses or penalties which happen under the blood center. For example, manufacturing or sale of adulterated or spurious blood product, adulterated blood product not covered above, manufacture of drugs without valid license, spurious drug not covered, drug manufactured in contravention of any other provision, a non-disclosure of information or not keeping the documents, and this is for the first time. If you have subsequent offense, then the tenure of your imprisonment increases and the fine also increases. Okay, Dr. Ganesh Mohan from KMC Manipal asks that if a product is licensed as addition to the original license, and 2 years later, your local drug controller informs you that you are not licensed to collect the product because the additional product issued issued in separate, is not included among the product list in the main license. How to proceed? You have to restart it from the beginning, that reapply for this new product and start it from scratch. Regulatory, Dr. Aryabhat, I think we covered it entirely in this entire session. Dr. Vijay Singh asked how to apply and the procedure with essential requirement for applicating and renewal of blood center. We detailedly covered it in the entire session. Ashu Dogra had 2 questions: preparedness for inspection of new blood center. This we covered. For the late inspections, once from our side we have submitted the application for the renewal of the license, then if there is no communication or there is a late inspection, still we can run the blood center as I have already mentioned, and the late inspection will not have any impact until and unless that is later they give us a document that no, your license has been cancelled or something, then only our license is being withheld, or else we can still continue with running the blood center. The drug inspector tend to implement guidelines in a stricter manner. Just let's take it in a positive way, that it's just to help us out for ensuring that our all the documentations are correct, and we are ensuring that the communication of the documents have been kept correctly. Because blood is a very vital entity in the health services, and it's a drug, and we are in kind of a manufacturing sector, and we need to ensure that we are able to provide the safe blood transfusion both to the patient, and we are also able to take care of the donor in best possible manner. Change of premises, again you have to apply informing the licensing authority that what change you are going ahead, and then you have to sometimes if it is a small change, then you will be just asking for a change in the location, something you are modifying. Even if you are modifying a single thing in your map, that also has to be communicated to the licensing authority. Suppose there is a change in premises, you have to apply for a fresh license altogether right from the beginning. Is license required to procure and dispense autologous PRP for cosmetic or orthopedic procedures? This was from Dr. Manish Nair from Indira Gandhi Medical College and Hospital. This till date, no, even it is not mentioned, not much mentioned in the Drug and Cosmetic Act as well. Okay, all best wishes from my end, Dr. Tarun Kumar. Okay, Dr. Deepali Patil has asked regarding the NOC of SBTC. Dr. Deepali, NOC from SBTC will be required if it is from sometimes a hospital-based blood bank, charitable trust blood bank, or any standalone blood bank. They do need to have the NOC from the SBTC. Operation from the operations of FDA site, I think it is very state specific for Maharashtra only. And this is the website link. Even I'm using it. So this is the website link which we use. They issue us the ID password and training for them. I think we have to get in touch with our local FDA authorities to guide us how to go about this further. Absence of pharmacopoeial reference for additional blood components and blood products, then I think this we just have to explain the drug inspector, and many a times they are very cooperative enough and they do understand that yeah, it is not mentioned, and we need to have the pharmacopoeia in hand to show that yes, it is not available currently in the pharmacopoeia. Then we can few centers have designed their own labels and have asked the drug controlling authority for those products. Dr. Parthasarthi has asked QC parameters for laminar airflow. For the laminar airflow, you have the culture plate growth, so one can do, and even the airflow meter one is available, where with which we check the flow of the air, whether it is proper or not through the filter. Micropipettes, there is a very elaborated um, um, micropipette QC, which where we check the volume of the distilled water. We need to take the reading 10 times, and then we have to in a very controlled environment where we control the temperature, the air, and the pressure, and we do it. For manual plasma expressor, I don't know any QC parameters being available. If anybody from the audience knows it, can do answer it. Money to be given for licensing. Dr. Saurabh, I already mentioned it during the initial slides of the presentation. I think that would be clear enough. Okay, coming to the license for irradiation using linear accelerator and other blood component additional. We need to develop the SOP. We need to have the labels ready at the time of inspection, and we need also to have these equipments available with the institute, with your same IQ, OQ, PQ list of equipments. It should be installed at the blood center or at the hospital site to proceed ahead for the licensing procedure. Okay, this is beyond the scope of this session. Dr. Suraj, I think we covered already in this entire discussion. Regarding leukodepletion of RBC, we have to get it under license. You have to have your SOPs, your equipments available for leukodepletion. and like your sterile connecting device or your adequate blood bags with inbuilt leucofilters, and also you have to perform the validation studies uh, prior to even applying for the license. And once everything is ready, then along with the SOPs, the blood bag labels, will be applying for the license as an additional component for the leukoreduced PRDCs. And okay, this is the last question. If irradiation is outsourced by a blood center, but the irradiated units are being issued, then again you have to have the same thing being, you need a license where you have to show this entire procedure on the SOP. You have to have your labels, and you also have the IQ, OQ, PQ, and the installation and everything of the irradiated machine what you are using, and all those documents need to be submitted to the licensing authority. For the leukoreduced bag, the get the bag, prepare the product, do the validation study, then you apply for the license, rather than the other way around. For maintaining two cell separators, no. Here for the apheresis, for any blood component area, what we talk about is the minimum area what is being required, and it is not the maximum. So it is minimum 10 चाहिए. 10 के ज्यादा आप कितने भी रखो, like you can have a 20 square meter area for a apheresis, but you can just keep one machine. So if you have two machines, you need a bigger space because you have to handle both the couches also. So accordingly, you need to decide your plan. Okay. Before moving further, this just a the entire licensing procedure is just to ensure that we do give a very safe blood transfusion to all our patients who are in need of blood transfusion, and also at the same time we are able to take a good care of the donors as well. And always ensure that you document your all your communications, and you communicate all your documentations, because that is the only thing which always helps to save you from any legal litigations, and we always have to protect our own skin. Before I end my session, I would specially acknowledge Mr. Satish Chauhan. He's our local drug inspector from the FDA, who helped me get few of the answers of these questions which were asked by many of the participants. So thank you, everyone. We'll be taking about more questions from the audience.
Thank you so much, ma'am. Thank you so much for this very informative session. As you've already pointed out, like this is a very less discussed topic among post graduation or even during career also. Thank you so much for being the speaker of the session today, ma'am. Thank you. Ma'am, you've already covered Google Form questions.
Yeah.
Now, like we are having a certain set of questions in the chat box that are also
Yeah. Can I
not
how to make my screen big? It is showing me small only.
Can you stop sharing? Then I can do it from.
You stop share. Just stop share. Okay, okay, okay. Got it. Yeah. Yes.
Okay, ma'am. We'll move on to our first question in the chat box, which is by Partha Sarthi. So
Hmm.
the question is, do we need separate license for cryopoor plasma and frozen plasma?
Yes, we do need. Fresh frozen plasma will be on a separate license, and cryopure plasma many like it's better to have separate license. Have as much license as you want, just to be on a safer side.
Then another question by Sugandhi is, charitable blood bank should take NOC at what interval from SBTC?
Due at the time of application, you do have to apply, and many a times you may have to apply also at the renewal level.
Okay,
But
thank you, ma'am.
mostly it is required at the application stage.
Thank you, ma'am. Next question, I think we've already discussed this, ma'am. It's by Kirti Anganapalli. Kindly help with the label for irradiated component.
Okay, label for irradiated component, you can include all the whole blood entities, and then many a times we need to devise the labels based on the one which is showed in the presentation is the label which is for our this thing, the label which is for the PRBC or the whole blood, which is being given by the which is given by our DNC Act. But for the FFP, for platelets, you have to change the labels accordingly, just to ensure that the quality of the the quality of the product is ensured, because many times at the bedside they do read the label of the blood bag what we give. So for the irradiation, where to start the transfusion as early as possible, where do we store it? Same things what we will be continuing.
Thank you, ma'am. Next question is by Harkiran. Whether license for stem cell is required?
Yes, license for donor stem cell collections is required. These days they do allow the blood centers to have, but you have to show your preparedness for the stem cell collection, where you have to have your site ready, your equipments ready, your storage equipments ready, your biosafety cabinet being available, if you are doing it around the blood center premises. So you need to have everything available with you to have your hematopoietic stem cell license as well.
Thank you, ma'am. Next question is
And,
by
yeah,
Charan.
and one more thing, you have
Sorry, ma'am.
also need to have your registers for the stem cells and all the SOPs. They also ask the ICMR guidelines for the indications of stem cells, which is already freely available on Google. So those all things you have to have in the on your application for stem cells.
Thank you, ma'am. Next question is by Charan Singh. Any
Okay.
SOP of written blood bag and expiry date on blood bag? Any SOPs are required for this?
SOP, it's always better to have an SOP. There is nothing wrong in having an multiple SOPs, because standard operating procedures are basically instructions what we try to give to our staff in uh, how do they function in order to ensure smooth functioning of the blood center. So have as much as as many SOPs as possible. Yes, return of blood bag. You have to have a SOP, because even when you go for having a hospital transfusion committee meeting, they will ask you what is the SOP, by what time you'll accept the blood bag. So that SOP needs to be consistent with the entire hospital. And what you are saying, like suppose you are saying I will accept a blood bag after 1 hour of issue, that you will be written in your SOP. That will also be written at your a hospital transfusion committee level as well. Coming to the expiry date SOP, so it is very much being taught at our postgraduate level, that you have to keep your PRBC for 35 days, your the Sagam bags 42 days, platelet 5 days, and other two are for 1 year. Only thing is, whether you consider the date of collection to be 0 or 1, it is very much center specific, is what I have learned over the years.
Thank you, ma'am. Next question is by Parth Sardi. For cryoprecipitate, is it IP or USP or BP on the sticker?
I think it is BP or USP. I have to check my label once. I'll just have a look. It is USP, I guess. I have to recheck. I'm seriously telling, I have to recheck once.
Okay,
But
ma'am.
yeah, whatever it is, IP, PRBC and whole blood is IP. I think FFP is BP, cryoprecipitate is USP, platelets are also USP. This is what I vaguely remember.
Okay, ma'am. Thank you. Our next question is: do we need to take license for autologous stem cell apheresis?
Autologous, if you are doing it in the blood, anything happening at a blood center site, it is better to get it covered. But if you're doing bedside, then nothing is needed in a separate area completely.
Okay, ma'am. Yeah, thank you. Ma'am, next one question by Antonio Paul. What he has mentioned is like somebody has told no need of license for CPP as it's a byproduct.
It could be center specific. If somebody has told no, then follow it. Or some drug controller has told no, then good. You don't have to apply for apply for this as an additional component. But if then they ask, then you have to apply.
Thank you, ma'am. Next question is by Vijay Kumar Narayana. So the question is like if the bag expiry is on 31/8 and the blood collected is on 15/8, can we use the blood for 35 days?
You want to use it on the last day of collection, right? Oh, yeah, it is before the 31/8 is the bag expiry. If you are collecting it before, you can use the blood bag. I hope I am clear with the answer. Like this is what I'm understanding.
Thank you, ma'am. One other question by Dr. Aruna is when we go for renewal, should we review our SOPs? Will will review, and she has already also mentioned, will review definitely if any changes are there. But is if there are no change, should we still change the date of review?
If you have reviewed it, you have done some work. So why not to document it? It is always best to document your communication and communicate your documentations. So it is always ideal to have the documentation being done appropriately, uh, and you have checked it. So why not to include it in your license? This is what is my take. If there are senior members in this discussion, they can comment further that whether should we do go for it or not.
Thank you, ma'am. Ma'am, Dr. Akshay Batra has commented cryo is USP.
Okay. Yeah, it like the only thing, whenever we have to make the labels, we remember at that time, then we forget about it.
Thank you, ma'am, and thank you, Akshay, Dr. Akshay. Ma'am, next question is uh, next. Actually, it's commented by Dr. Antonio. So he has commented. He thinks SOP should be reviewed and amended if needed in every 2 years.
Yeah, that's, see, it's always, we will be always modifying something over the time. So it is always better to have a look at your SOP at a timely interval, by which you are also updated, your staff is also updated, your even hospital is updated. And do keep it in mind, many a times we get certain suggestions for the SOPs from the drug controllers as well, and we also need to comply to that. That we need to improvise on our SOPs, where we need to make certain corrections or certain what do I say? Certain modifications is what is being asked in the SOPs.
Thank you so much, ma'am. Ma'am, we think we have already discussed about all the queries in the chat box also. Now it's an open discussion. Anybody else wants to raise queries, they can raise the queries.
The force mute has been made off. If anybody wants to ask, they can unmute themselves and ask the queries. Anila, I think there are no more queries.
Okay, so Sir, shall we wind up the discussion?
Yes, please go ahead.
Okay.
No,
So,
we have
sir,
one
there is
more.
a last query that's by Dr. Parth Sarthi. So, the query is that if we shift the sterilization to the CSSD, do we need to maintain a separate register?
Uh, s- if yeah, you're keep first of all, if you're separating it to sterilization to CSSD, first of all you have to get it documented and approved by the licensing authority. That is the first thing which you need to keep it in mind. And you have to add the same to the licensing authority body before you even go about with the licensing procedure. And yes, you have to have the register maintained because you are sending the things to a different entities. So it is always better to have a documentation of the registers what you have, a documentation of the things what you are sending for sterilization to CSSD.
Okay. Thank you so
Next
much.
question is, do we need to ensure separate? Yeah. We have one more question, Anila.
Ma'am,
Do we
that
need to
question is,
ensure us?
uh,
Do we
We have
need to
around
ensure the autoclave is kept separate? Yes, need to. Uh, yeah. Uh, okay. So moving ahead, do we need a autoclave? Yes, we need to keep a autoclave bags at the blood center, and you have to discard them at your blood center, document that, and you discard it, send it to your medical waste management as normal, as regular practice. What you do, and you do need to have a small autoclave. It may not be the hi-fi version one. You can have a smaller. Few centers do also have that, and I do process that bags um, at the blood center, blood center itself, at the blood bag. You can go for a bigger autoclave, but if you are not doing it, then you can manage the entire thing with a small, like some 20 to 30 liters autoclave at the blood center. Yes, you need to hire NOC, and the pollution control certificate is mandatory for license application. These documents you generally get the pollution control certificate. You will be getting it through your biomedical waste division, and the fire NOC, the your institutes the construct engineering division will be able to provide you with the same. But yes, we do need to add through documents to the entire application procedure.
okay, thank you so much, ma'am. I think there are no more queries in the chat box. Ma'am, thank you so much for this. One more query is there, ma'am. So this is by Dr. Punkesh
Okay.
Patel. So the question is, if any
Okay.
teratogenicity happens to a patient's child due to transfusion related to donor's medication, what can happen?
As such, first of all, it will come on literature, and then how it has to be proved, and then technically, I'm sorry, I won't be able to answer this because I have to look about it in the literature what can happen.
I think most
If
probably if a
anybody else
donor
has
is
a
taking a teratogenic drug, he will not be possible to donate. No?
if the history has not been taken carefully, then we might escape those donors. If you are menting that, then yeah, there is a like those escapes, but then it all depends on how good is your counseling at your blood center happens. So ensure that you do the best of the best counseling. You avoid these donors who are on certain drugs, which can possibly be teratogenic to the fetus, for the drugs which are they being exposed to.
We'll keep the link for the certificate open for at least 2 more minutes. Whoever has not done it can just fill it up. Anila?
Madam, thank you so much for this wonderful session, ma'am. It was very, very, very informative. And thank you so much for being our speaker for this team as second academic session also. Thank you so much, ma'am.
Thank you, everybody. Thank you, Timas, for giving the opportunity. It's a very nice initiative, academic fest, and offer all the participants the entire journey of the licensing we learn by doing. So anytime you will be joining any of the new blood centers, or you are involved, uh, you are joining certain new blood center, or you are joining a center which is going for a renewal, do get involved in the entire licensing procedure, including the civil construction work. Do give your inputs, because that is what I had done in my SRship days, and that helped me a lot in setting up a blood center at a very new setup at AIIMS Nagpur. So do get involved yourself in the entire procedure. Yeah, it is not a textbook taught. Everything happens through the experience. Everything happens. There is a lot of role of our soft skills, our interactions with our local drug controllers. So do keep that in mind always, and do cover it, and everything is given in the book, like the DNC Act, and the even the DGHS is a very good tool for knowing about the entire procedure. And for the exam purpose, the those that the cover the regulatory chapter uh, completely. Like you might be asked the fees, how much is the total fees. You might be given certain scenarios of the regarding the fees. You will be given which form to apply, and remembering the form numbers is always confusing. And again, these pharmacopoeias, USP, BP is again a confusing term. So do keep it in mind, all these things. And all the best. And this is a very untouched topic when we are postgraduate students, and and we are directly thrown to so many a times to start a blood center. So yeah, that becomes a very interesting journey altogether. And you will it's a very learning procedure, and it's very fun to start something, and you can later tell that yeah, that blood center you have started, or you have constructed, and it becomes a like kind of a second home for you, that you have even started, where the brick was kept, where what you have broken, where you. And yeah, I forgot, just to keep it in mind, even for tables you have to have marble top tables. This I didn't cover in the sessions, because of the easy cleanliness. And initially I made a mistake that I got wooden, then I was told that you have to get marble. So these few tiny practical things which we learn over the time, and that is what I had shared in today's session. All the best, everyone. Thank you for the session.
Thank you so much, ma'am. We are currently winding up the session. We request all the participants to kindly fill up the forms for certificate. We have posted the link in the chat box. So please register register for certificates via the link. Thank you. Thank you so much.